going to get started, let me start off by saying good morning and good afternoon to all of you. Thank you all for joining us today. All of you from all over the country, public health professionals who we see as colleagues, working together in the fight together to support our field, support our science, support our programs, and support the communities that we all serve. I want to start off by acknowledging that this is a moment. This is a moment in time for us all as a field. And what we need right now is not hope. What we need is action. What we need is action from all of us in the field, as well as action from our decision makers at the state and federal levels. I, as the moderator for today's session, am excited and hopeful, and not just hopeful, but focused on taking action-oriented steps to push policies forward and, importantly, secure funding for the work that we all do. I'm grateful to be joined by three distinguished panelists who've been doing great work for decades for the field of public health, and great work not just in the past, but in the present moment that we live in today. I'm joined by Matt Wellington, who's the Associate Director for Maine Public Health Association, Sharon Gilmartin, who's the Executive Director of Safe State Alliance, as well as Katie Koster, who is the Vice President of Federal Government Relations at the Campaign for Tobacco-Free Kids. You all have their bios in your email. Considering that we have limited time and we really want to get right into it, get right into the heat, the meat of the conversation, I'm going to just jump right in. And let's jump right in, starting off with Matt. Matt, you have been one of the most vocal voices in the country on the impact of the administration's cuts on the state level, at the state level. I'd love to hear from you, Matt, directly. Why does public health investment matter right now?
Thanks, Tesfa, and thank you so much to the Learner Center for hosting this and having us on it. Definitely looking forward to the discussion. So, public health investment, I would say, matters as much as it ever has. I want to take a slightly different tack and say that from my perspective, what matters more now than potentially a couple of years ago is showing the return on that investment, right? So, public health people do amazing work, oftentimes behind the scenes, and they are not usually out in front of the TV cameras or reaching out to people touting their accomplishments. But that's what we have to do right now because we can't take for granted anymore that people understand public health and the value that it brings. We have to show that very clearly to our policymakers, to decision makers. And I think it's twofold. We need to win hearts and minds, right? When you're talking about running a campaign, you got to win hearts and minds. From my experience, public health people are really good at winning the minds. They don't focus as much sometimes on winning the hearts. And I see Katie nodding. And yeah, we need both, right? We need the hardcore data to show the return on investment of public health programs. And we need those compelling personal stories of impact. So that's where I mostly come in. And I'll talk more about that throughout the discussion.
Great. Thank you, Matt. Really important points that I'm looking forward to digging into throughout the conversation. Sharon, I'll turn it to you. You've made the case not just for our field, but to key decision makers and winning the hearts of key decision makers, as Matt has pointed out, not 5 years ago, but most recently to secure funding for CDC's Injury Prevention Center. Can you share from your perspective, why does public health investment matter now?
Well, first of all, I echo Matt in thanking the Learner Center for hosting this, and I echo Matt in so much of what he shared. I think what he talked about talking about what the work really looks like on the ground and telling the story of it is so essential. In public health, we're really good about talking about numbers. We can talk about big numbers, and we think it's really compelling. But the challenge is that the policymakers don't necessarily they don't really align with that. It doesn't mean much to them. So what we have to do is make it personal. We have to help them understand what it means for their communities, their jurisdictions. And I don't want to put a negative spin on it, but the reality is that what we don't invest in today ultimately becomes the emergencies that, quite frankly, we can't afford to treat tomorrow. So, that's a dollars argument. That's a human lives argument. So what we have to really keep drilling home is that these systems, it is a system discussion. they're what's keeping America safe. And that could be injury prevention, that could be disease surveillance, that could be maternal and child health. And that is really the backbone of well being in this country. And what we as citizens want and what our policymakers want is well being. It's not just the absence of disease, it's a quality of life. And I think that is a really interesting discussion point for all of us.
Thank you, Sharon. In Sharon's remarks, she shared that the investments matter across a variety of issues and public health issues. And Katie, I know you've worked on a number of public health topics and a range of topics from HIV/AIDS to cancer and now tobacco at the Campaign for Tobacco-Free Kids. Can you round us out and share from your perspective, why do public health investments matter right now?
I think about this in a very pragmatic way, in that we just have to preserve what we have right now. If it goes away, getting it back is going to be a million times harder than holding on to what we have right now. And I think we often think about pushing things forward, and that's really important in making the case. But I think as this sector is really under attack, holding on to what we have, even if imperfect, is going to make it easier for us down the road to maintain a strong system. But if we pull back and that money gets pulled back, trying to bring it forward again is going to be almost impossible.
Thank you all. But thank you all for sharing that. And as we go through the conversation, there's a couple of things that I'd love to touch on. And I'd love to touch on this unique moment in time, which you all have acknowledged, and the importance of preserving what we have right now, and the benefit of us being engaged and how do we engage. And I'd like to think through and just talk through, as we contextualize the moment that we're in right now, how does it compare to the past? Over the past 2 years, things have changed dramatically for us as a field. And for many of the folks who are joining us today, this may be their first time understanding advocacy or really engaging in advocacy, considering the changes that we've had over the past 2 years. And so my question for you all is, looking back prior to 2 years ago, has public health advocacy changed over the past 2 years? And in comparison to what it used to be, and what are the unique things that we need to account for today in public health advocacy that we did not have to account for prior to 2 years ago?
I can jump in because I think Katie started alluding to this a little while ago. But just to build on that, even 2 years ago, when we talked about public health advocacy, we were really just talking about making the case for investments or making the case for a specific policy. Fast forward to today, we're defending the existence of the infrastructure itself. And so part of advocacy is even just having the courage to show up and say something out loud. We've sort of gone from this how much to fund public health to now we're having to justify and debate whether to fund it at all. So, before we even get to like the strategy and the messaging side of it, we're sort of talking about something more fundamental, which is just the willingness to speak at all. Tesla, obviously the environment has changed, both professionally and personally. I think people feel like there are real consequences for public health voices right now. I'm watching a lot of people self-censor, whether that's because of a directive from an institution or an agency or just personal concern about speaking out. And that's really challenging for our field because if nothing else, we should all be able to feel comfortable sharing our research, talking about our work, just sharing the good work of the field without fear of retribution from an administration or even from a home organization. So one thing I'm definitely paying attention to is sort of this idea of silence and neutrality, because the reality is that silence is not neutral. And every time that we do have an expert who's going quiet to protect themselves, the other side gets to define the terms unchallenged. You think about like what it's like to be courageous as an advocate. And previously, maybe that was talking about something really controversial. I work in injury. Firearms is one of our topics. So maybe talking about something that was politicized. Today, it's just being in the room, being, in front of a camera or a panel, and saying what you know to be true when you're aware that someone may potentially have the ability to use it against you or your institution. Um, I could go on and on. I'll pause here, but I
Yeah,
think that's such an important question.
I want to jump in on something Sharon said. So this vacuum of information, right? So when you're silent, this is a general thing I talk about all the time with our members. And just as some context, I used to work nationally as a campaign organizer. So my background is advocacy, communications, organizing. I don't consider myself a public health expert, but my job is to help folks who are public health experts fill that information gap. Because for years and years and years, I think we took for granted as a field that people would understand and see the credibility of public health and act on our recommendations. I think COVID obviously changed some of that, and then especially now in our political moment. So just like absolutely nailing that. If you're not the one out there talking about the issues that you have expertise on, trust me, someone will fill that information gap. And I can pretty much guarantee you they're not going to be as credible or correct as you are, and they could actually be incredibly harmful. And that is what has led us to this moment in a lot of ways. And then to your question, Tesfa, I think for me, I've always understood that it was probably never going to be enough for me to go to a decision maker and lay out the facts and say you should do this because it's the right thing. That is almost never enough. I think for a long time, public health, that was enough, right? Public health experts could go into a room with policymakers and say, here's the research, here's the right thing to do based on evidence-based systems change approaches. And people would act on that. I have an example of that here in Maine where one of our former CDC directors told me that back in the day, there was some kind of mosquito-borne illness outbreak, and she went to the school districts and said, hey, you know what? You guys have to move your sports games to Sunday afternoon rather than Saturday nights because Saturday nights are when the mosquitoes are out. And all of the school districts complied. No questions. They just complied. All right, this is what the public health folks are telling us. And she told me she really doesn't think she'd be able to do that now. There's no way that all the school districts would just immediately say, oh, of course. Like there would be debate, there would be tension. So that's the moment that we're in, right? I think that has changed. Credibility is just no longer enough. We have to make sure that we're continuing, like Sharon said, to speak the truth, even when that can sometimes be incredibly scary for good reason. But we also have to think like organizers, right? You have to think now about how to build and use political power in the service of public health. And I think that has changed dramatically in the last couple of years. And that's like my personal mission to help equip public health professionals with the tools to do that, because that's how we never end up in this situation again, right? We need to think like organizers long term and build that power. So, like Sharon, I can just blab and blab and blab. So here you go.
You know,
Over to you.
no, Matt, I agree. I think what I've seen it on the global health advocacy side, I've seen it on the domestic health advocacy side over the last 2 years, even the last 20 years, is this like inability to think about how we do advocacy differently. It's like, well, we're going to do the same thing we did for the last 10 years, make the same ask, even though we've had zero results in terms of increasing funding. But maybe this year is going to be the year it's going to happen. I think it's really hard for those of us who work on a specific issue and we see it so clearly and so rationally. And if only understood this is killing people or whatever, they're gonna, that's what's gonna make a decision. And it's, I think, been hard for the public advocacy community over the last 2 years to start to think outside the box, stop quibbling with each other over literally the most minor things and really band together on some of the bigger picture items, including preserving the infrastructure. And some of that's just the way that we're organized, right? Clearly, like by disease or specific area. And so you kind of care about your disease. I've only ever worked on disease specific groups, like, instead of more broadly. But I think having that openness to say it's not just about my issue or your issue, it's about the bigger infrastructure is going to be really critical for us moving forward. But, 2 years ago, we were debating minutia of policy, like words. And now it's like, just don't cut the funding. It's like wildly different.
Can I just flag something that came up in the chat that's really important, Tusfa? Someone said they're told they can't advocate, and I know this gets confusing, but to be clear, and I think Sharon and Katie would say the same, when I'm saying advocate, that is fully C3 education focused. C3 is in like 501c3 nonprofits. We don't engage in political campaigns in terms of elections, but advocacy for me is pretty interchangeable with just the word education, right? So educating policymakers about a proven policy solution is different than lobbying. And sometimes people, it just, we need to be clear about that, that advocacy is just education. Lobbying, you're making a specific ask to a specific legislator to support a specific piece of legislation. So. All right. Sorry
Thank
about
you for
that.
that clarification.
Well,
Yep.
to jump in as well, there are actual legal protections for you where you are, as a private citizen in your own time, you are allowed to reach out to your legislators and share your expertise. You provide credible information just based on your entire background, not based on a title or an organization with which you're affiliated. And there are laws protecting you and giving you the ability to do that. The other point I just wanted to quickly share because it's interesting to hear, and I agree with everything that Matt and Katie have shared. The one extra side of this though is that there are still fundamentals of advocacy that just aren't that complicated. This is about building relationships. This is about having conversations. This is about sharing insight into what keeps our community safe. And so we can get really granular, and trust me, we will, and it's fun. But the big picture of this is that we don't have to overcomplicate it. You just have to be willing to start somewhere and have a conversation.
Thank you. Thank you all. Well, two things I want to follow up on. One, for our colleagues who are joining us, know that we will have resources to share after this webinar on the difference between advocacy and lobbying. So for those of you all who are faced with that challenge, which many of us are, on how to advocate in your current role. And as our panelists mentioned, there are ways to be an advocate that don't run afoul of any lobbying roles, and we will share those resources with you all after today's webinar. And the second thing I want to get to, you all brought up really great points on how do we engage, the importance of filling the information void. And there's this tension where we need to engage. We need to make sure that we fill the information void, but we have a credibility issue. We have a credibility issue as a field. Can you give specific examples of how to overcome that credibility issue, knowing that there's a need to fill the void, but if we're filling the void and we're not seen as credible, then that inherently presents a challenge for us as a field?
I can jump in quick because this is very much on my mind in the last couple of weeks. For me, kind of to Sharon's point, like it's not super complicated in a lot of ways. You just have to show up and be present in your communities, I think first and foremost. So MPHA, we've been doing these community conversations all over the state, where we're going into especially rural areas of Maine that tend to lean more conservative and just asking what is top of mind for you when it comes to your health, your families, and your communities. They've been amazing discussions. People have reached out to me afterwards and said, thank you so much for coming north of Bangor. Public health people almost never show up in this part of the state. And I think that's the first step, right? Is it's not enough to just post on TikTok or whatever. You got to show up, like go to the places, especially if you're working in a state, show up to the community meetings, go to the Rotary clubs, make the rounds, and be everywhere you possibly can. Because the more that people know you and see you and trust you, then they will find you more credible when you give them actual public health information. And that's been my experience with these listening sessions. And then like doing something, right? We're not just going and having these listening sessions for the sake of having listening sessions. Four consistent things have come up in these across the board: housing, transportation access, community connection, and economic opportunity. And so now our next step is how do we do something about these, right? As MPHA, how do we fill some of the gaps that we're seeing? How do we plug in on policies, programming, resources, and go back to those communities and say, we heard you, here's what we're doing about it. So that's my take. It's just get out there. You got to show up and be seen.
Yeah. Man, and I think one of the things we see as a field as this idea is it's under attack, but individuals, constituents, I don't think have the same type of like offices are not as resistant to hearing from constituents who work in the field than they are from maybe like top experts. So I think one of the things that we've done at CTFK, we work with Matt and other groups in states to work with folks who are interested in public health to do that, to reach out to their members specifically, because hearing from a mom whose child is using e-cigarettes or hearing from a nurse in a rural community, that resonates so much more and so much more deeply at times and can be incredibly impactful, more so than like a fact sheet with a couple of numbers on it, right? And so this is why having public health professionals do advocacy and reach out is so important, because there is a deeper credibility when you're coming from the community that the legislator represents. I think they're more, you're able to talk about your favorite restaurants or, where your kid goes to high school, and that kind of localness really, really does impact policy change. It may not feel like it, but you will hear Senator Collins say, I met with teens who are really concerned about this, and that resonated with me. It's not because she read a fact sheet from CTFK.
I could jump in really quickly here, and Sharon, I know you're going to add to it, but just 1 minute. I see a comment in the chat, and it is related to the lack of resources. So the theme for this three-part series is advocating for funding for public health resources when resources are scarce, right? So that's the theme. We're all advocating for resources, and many of us face the challenge where we don't have resources within our own organizations. Each one of you are in a challenging situation, but in some situations in a unique situation in comparison to others where you have an infrastructure within your organization to support your advocacy work, where many do not have an infrastructure within their organizations to support their advocacy work. What's your recommendation for folks who don't have that infrastructure, who want to get engaged, who want to make change when they don't have an internal infrastructure to support their work, knowing that the recommendations you all are providing are resource intensive, require time, money, and capital that we have limited amounts of?
I'll say super quickly that it is the case that we were able to secure a small grant to do those community conversations. And so those resources absolutely helped us make that happen. I think it's a choose your own adventure kind of approach, right? So based on your own resources, you've got to tailor your approach for what you can do. So if I was in an organization that didn't have those kinds of resources, I'd think, what will I get the biggest bang for my buck from in terms of visibility and impact? Media is a great one, right? So writing opinion media to your local paper doesn't take a ton of time and it has an impact. I know for a fact policymakers either read the opinion sections of their hometown newspapers themselves or they have staffers who comb through it to see what their constituents are talking about. That is a low lift tactic that has a pretty big impact. So, thinking in that way, you don't have to have $1 million to run a massive campaign and with all the bells and whistles. You can be scrappy. Trust me, I've had to be scrappy many, many times in my career with no money. And that's how you should think. Like, what is the biggest bang for my buck in terms of how I can make an impact? Again, opinion media is a great one. And honestly, again, like Sharon said, it's about relationships. So just having regular outreach to your congressional delegations, your local representatives, whether it's an email a month, right, can make a difference, or one meeting every other month where you check in with them and say, hey, here's what's top of mind for me, can also make a big impact.
So at Safe States, we started a campaign, like Tesfa alluded to, and it was focused specifically on funding for the CDC Injury Center. And two of the cornerstones of this campaign were elevating local voices, because nobody wants to hear from talking heads, quite honestly, and making sure that we use the media to our advantage. So thank you to Matt and Katie for teeing that up so beautifully. Yes, opinion pieces, getting in your local paper, those are all really great ways. And those are great tools because say you get an op-ed in your local paper. Hopefully your legislator read it. If not, it's a great excuse to reach out to them and send them a link and say, I thought you might be interested in this, would love to talk about it more. But the thing that I was actually going to say when we were talking about credibility, and this applies to all of the different topics that we're talking about, is think about your partnerships and how you can leverage your networks, because you individually don't have to do everything alone. So when it comes to credibility, different people have different access to different communities. Inherently, public health, we partner, we convene, we collaborate. So this is very much in our wheelhouse to do. So that can help gain credibility in areas where maybe you as a professional, you as an organization don't have as much traction, but someone in your network does. And the same goes for the advocacy limitations, right? Again, different access, different pathways. And so partnerships are really essential to all of this. Specifically for the resource question, there are so many different coalitions in existence right now. Some of them have more focused goals. So like, I mentioned we have our Keep America Safe coalition that is focused on really protecting one piece of CDC infrastructure. There are broad public health coalitions. APHA is running one right now. There's a coalition for health funding. So you can also join into existing movements and elevate your specific sub issues, because that is a way to use, your resource at that point is some of your time, but you don't have to, dedicate 3 FTE to that at that point. You can sort of be part of a larger movement.
And Katie, I'd love to get your thoughts on this. I know at the national and global level, you all work with partners who have the same challenge. Any practical tips that counter what Matt or Sharon shared, or complement?
Well, I think, well, to say compliment, and I saw there was comments around organizing. Sharon said, this job is not that hard. It's not. Like, if you can write at like one email, you can be an advocate. And sometimes when we think about organizing, it feels like really big, or like national coalitions. Organizing can be that you call your congressional office, you say, hi, can you tell me who the staff person is that handles health appropriations? And can I have their email address? You then email 5 of your friends in public health and you say, hi, Susie Jones is the health staffer. Can you please email her and say, I really care about public health funding? Congressional offices literally track in like a spreadsheet the number of constituent outreaches they get on a specific issue, pro and con. And I have been in meetings where somebody will pull it up and say, oh, let me see who I've heard from on this and how many. And so that's an incredibly low intensive, low effort, but highly impactful, especially if you're sending it to 5 or 10 friends and saying, hey guys, send this email. And send those emails once a month, especially I might be jumping ahead here, but especially in February, March, and April. Send those emails, say, hey, just want to remind you, I am your constituent and I care about this funding. It is, advocacy doesn't have to be labor intensive at times. There are different levels of capacities, but there is something that everybody can do that will actually impact how a congressional office takes a position on a specific issue, or in this instance, funding.
Thank you, Katie.
Can I jump in too, Tesfa, on that really quickly?
Sure. Can I ask you to hold on that, Matt? Because I think jumping in may be relevant to what we get back from the audience. What I'd love to do is ask the audience directly, what barriers do you all face and anticipate as your biggest barriers when it comes to advocacy? And asking you, Matt, to hold because I anticipate that you'll have a response, and maybe you can curate your response based on what we hear from our audience members as their biggest barriers, and want to address the challenges that they face and provide some solutions to the biggest challenges that they face.
Yeah, that sounds good.
Thank you. All right, we're just taking a few seconds to for folks to respond to the poll. And I will surface up the key barriers and challenges that we see. And while we wait for the results, I want to encourage folks to continue to add your comments to the chat. I know that you all throughout, since we started, have shared what your biggest challenges are. and we will respond to them and continue to monitor them in the chat. A few things that we're hearing. One is challenges working in rural areas. That's one. And specifically, looking at how would your approach in moving public health forward change in rural communities where resources may be particularly sparse and there may be competing priorities. So a question related to engaging in public health advocacy in rural communities. Matt, I know many of you all have experience here, but Matt, considering that you want to jump in and then also you have experience working in rural communities, as you mentioned, do you mind taking this one?
I'd love to. Maine, I think, is the most rural state in the country in terms of population spread out, whatever the terms are, we're the most rural state. So we think about this a lot. And I'll say, coming off of something I think Sharon said, you don't have to do it all on your own, and sometimes you can't. We have a coalition now called the Healthy States Collaborative, which includes 35 of the state public health associations. So for folks out there who are not members of your state public health associations, please get on that. They're pretty amazing, and they're tailoring their approach locally. They're the people on the ground who have their fingers on the pulse, and it's a lot of really rural states, right? So we're looking at Maine, Oklahoma, Iowa, all of these states. So it's a big focus of ours, and I would say this kind of again curating what I was going to say before to this. One of the big takeaways I want folks to have from this webinar is that yes, there's definitely quick hit things you can do, like what Katie had said. One extra layer to add in there if you want to increase your impact is just remember what matters most is what the policymaker cares about and who they will listen to. And you can get a pretty good sense of that just from some basic Googling, right? Look on their campaign pages, on their websites, look on their legislator bios, just Google them. You'll get a pretty good sense of it quickly. And then maybe take the extra step of not having just reach out to public health folks in your networks, but business owners who you think they care about, and maybe the businesses they tend to spend a lot of their time in. Reach out to the owner of that business and say, hey, here's how this works for you in terms of thriving economies and healthy communities always being linked. And when I talk about tobacco prevention with folks like Katie and TFK, I am not the one in front of the TV camera because it's not as effective for me to be the one. The person that I put in front of the TV camera is a small business owner who I've known for many years now in our community, who has several examples of employees that she cares deeply about who have tobacco-related illness. And she talks about how she wants to increase policies to reduce tobacco use because it'll make folks like them healthier and will be good for her business because she won't lose out on lost productivity costs, healthcare costs. So I would just say when you're working in rural areas and trying especially to influence policymakers from those areas, just remember it's not necessarily you that should be the one out in the front. You got to find the people who should be the ones out in front and get them bought into what you're trying to do. Help them see why it works for them and is in their best interest for them to partner with you. And then again, put them in front of the policymaker and the TV camera. And I think sometimes that gets lost, that sometimes it's just not. I want people to advocate, but again, sometimes it shouldn't be you. It should be somebody else in this policymakers network who will actually be able to break in with them.
Thank you, Matt. Thank you. I'm looking at the results of the poll and want to use the results of the poll to transition from barriers. We spent a lot of time talking about the barriers and the challenges and transition to successes. And taking into consideration the results of the poll, where the majority of our colleagues who are joining us today share that all of the above, all of these are challenges, especially the political climate that we're in. As Sharon mentioned, that folks are fearful to speak up. And we're also facing tremendous cuts in terms of our individual and collective budgets in the field. That being said, there still are tremendous successes being accomplished in today, not 5 years ago, not 10 years ago, but today in this climate. Can each of you share something, a real success, practically, what you've been able to achieve and what surprised you along the way with achieving those successes and leading to the wins that you've had, whether they be small or big wins in the past 18 months? We'll start with Katie and then Sharon.
Thanks. All of public health has been under attack, certainly by this administration. And clearly funding cuts to tobacco control and prevention at CDC, much like Sharon talking about funding. And I think what's really important for us to remember as advocates, and oftentimes we focus on Congress and we focus on the numbers and appropriations and getting that money to CDC, but the bigger challenges lately have been getting CDC to actually spend that money. And so while the Office of Smoking and Health at CDC was zeroed out by this administration, while the House zeroed it out, the funding was in the final funding package, and that was great, great win. But then the administration wasn't getting the money to states, and that's a huge problem, right? Because as you all know, in the states, that's where a lot of the work actually happens. And what we found out in our successful advocacy to get that funding out the door, it wasn't perfect. It was a shorter timeline to spend the money, was, as Sharon said, we had developed really strong relationships with key lawmakers, and we had constituents in their states that also had really strong relationships. And so those constituents were able to reach out as a credible source who worked on state tobacco control and prevention and said, hey, we're not getting this money, and it's going to impact this state in this way. Jobs, access to quit lines, access to other services. That put the pressure on bipartisan members of Congress, who then put pressure on the administration to get that funding out the door. And it really reinforced to us in that moment the important role of being a strong resource for these offices and a credible resource, coming in, talking about approaches in a pragmatic and realistic way. People like to be firebrand and whatever, but when you can talk about, realistic and pragmatic impacts, and talk about the local impact. Members care about the local impact. And we were actually surprised that some of the members who maybe have been quieter on our issues in Congress, but they were willing to put pressure on the administration to get that funding out the door. And it really have to think sometimes about the long game. Like, Congress is not, just getting the funding in an appropriations bill is not necessarily the win, making sure it actually gets to local communities. And so those relationships do really matter to create success.
Yes, I completely agree with Katie. And actually, I have a funny story that if we have time, we'll share about that particular process. We would not call that one of our successes. We'll put it that way. That story is more of a sometimes things don't go as planned in advocacy. So I echo a lot of what she shared. I would say, so our big win, I'll back up for a minute. The reason that we started this whole campaign and coalition, what we call Keep America Safe, is because even before the Trump administration came into office, the House zeroed out, completely just wiped out that CDC Injury Center from their budget in, I think that was FY24. So that was a signal to us, right? Hey, we have some work to do. And we went to the Hill and they said, well, the reason that it got zeroed out, it wasn't because there was some deep philosophical issue with the work that the Injury Center is doing. It's because not enough lawmakers knew what the Injury Center did, and nobody was going to bat for it. Well, okay, that's a solvable problem, right? So that was the impetus for our campaign. And of course, it happened to be very timely because then fast forward to last year and the president's budget zeroed out the Injury Center, and we fully expected the Senate and the House to follow suit. The win, of course, on the appropriation side, the win is that because of the campaign and all of the great advocacy, which really happened at both a national organization scale and at a grassroots scale, the end result was full funding for the CDC Injury Center in the final LHHS bill, and that even included firearm research. So that was a pretty tremendous outcome for us. But some of the other wins along the way, we got placement in outlets that we had never had placement in on the media side. We, got to be in the New York Times, in Roll Call, and Politico, and The Hill. These outlets that we know that the legislators are paying attention to. We do a Dear Colleague letter every year. That's just another tool, sort of in the advocacy tool belt, to help show constituents, show legislators that what their colleagues think about certain issues. And we had bipartisan support for the first time ever. And what I think was really interesting, going back to what Katie was sharing about how much Congress went to bat for us to get the dollars out to their communities, that also was a really nice entree point for us as part of that relationship building. To go into a meeting, first you can express gratitude, and who doesn't like to be thanked for something at the beginning of a conversation? So, you could go in and say, Senator Grassley, I'm so appreciative of, you reaching out to OMB and helping shake these dollars loose for the community. This is where we are, on the appropriation side. I'm hoping that, you can offer your support. And it really provided like a nice tone, which is not what you would ever think in an environment like what we had last year. The other surprise that I had was we were convening our coalition, and people kept saying to us, we're coming to these meetings because we want to advocate, but also because we're not getting this information anywhere else. So I do think that points to a need for all of us to be thinking about, and Learner Center, hats off too, because this is exactly what you're doing. We need to be better about not making advocacy this separate topic from the rest of public health and the rest of, this relates to all of our day to day, and this should be just a constant part of our conversations as a field.
Thank you for that, Sharon and Katie. And building off of that point, with advocacy not being a separate part of public health, that there's an important role that we all have to play in advocacy, taking into consideration the current moment in time that we're in right now. Today's June 2nd, 2026. There are important primaries that are happening all across the country, from Iowa to California. And we are all, as a country, looking ahead at the midterms. So not just as citizens within the country, but also as a field of public health, taking into consideration what's at stake for the field of public health. My question is to you, with this window of opportunity that we have right now, what can we do right now? Each individual member on this call, whether you are a recent public health graduate or you are 20, 30 years into the field, what is your advice of what we can do right now to take action? And I open it up to any one of you all.
I can jump in. I think that the name of the game for me in the last year has been imperfect allies are key, non-traditional partners are key, right? So not just public health folks supporting public health priorities, but engaging business owners. My favorite, and I'll answer your question in a second, Tessa, but my favorite story of imperfect allies, there was a state public health association that was working on a vaccines bill. And I saw somebody in the chat talking about the issues around disinformation and vaccines. And they ended up partnering with the NRA on this bill I can't remember if it was to increase access to vaccines or might have been a defensive bill to stop a bad vaccines bill from passing. And the reason was, and again, this wasn't my experience. This was someone who told me the story, so forgive me if the details are spotty, but essentially the NRA didn't want any of the vaccine-related illnesses or something like that to get in the way of their gun competitions for young people. And so they partnered with the Public Health Association in that state to support their effort. That's amazing, right? That's what we need to have more of. And it gets to this point of non-traditional allies finding common ground. And then to your question, Tesfa, putting your personal politics at the door, right? Public health is always going to be political, but it should not be partisan. We need to make sure that we are reaching out to both Democrats and Republicans in earnest. One of my biggest pet peeves is when I hear public health advocates say things like, gosh, we just got to buy our time until the next Democratic administration gets in, and then everything's going to be just fine. We're going to build everything back up. We're going to be good. No, 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 no. This is about the long game. It's about building power and making sure that every policymaker, whether they're a Democrat or a Republican, understands and values the core of public health and why it is good for their communities. So for the midterms, I would say the best thing you can do is reach out to candidates across the board running for office in your local elections, in your state elections, and tell them, here's what I care about. Here's the work I do. Here's what I hope you'll focus on if you get elected. And again, that is not, I wouldn't consider that campaigning in terms of like political campaigns. We're doing that with our gubernatorial candidates. We have a policy platform that we're sending out to all of them. That's information and education. And as soon as those elections are done, hopefully you've laid the groundwork with any of the candidates who end up winning, that they understand public health and value it, and then you can meet with them and be a resource for them. So that would be my takeaways for folks is when you're meeting with elected officials or people running for office about public health, try to put your own politics out the door. You might be meeting with lawmakers or folks running for office who disagree with you on 75% of the things that you care about. But if you can find common ground on the other 25%, you should take it because that's how we build relationships. And again, hopefully never end up in this kind of situation again.
Yeah, and Matt, just to build on that, people need to reach out not just when they want something. And I think that we get into these positions where we're like, okay, it's appropriation season, so it's time to reach out to ask for money. Reach out because I think, as maybe Sharon said, or Matt said, you saw an article and you thought, oh, this is interesting, or this op-ed, or I wanted to make sure you saw this, or this is what's going on, or invite them to an event you're having, right? Like, hey, stop by, we're gonna have a fair at whatever, at a high school or something. Keep sending those. And if you just always put like their scheduler or your member of Congress on your scheduling list, they're going to show up eventually, right? So don't think about it like it always has to be surrounding some sort of specific ask, because continued engagement is going to help them realize that this is a issue that my constituents care about.
Literally just did this, Katie. One of our lawmakers, their health priorities is around tick-borne illness. I recorded a podcast with someone who focuses on tick-borne illness, and we sent it to the staffer just as a heads up, like, hey, you should check this out. I think you'll find it interesting. No ask attached to it, right? It's totally, and I'll just say Sharon's point before is my first hot tip anytime I do an advocacy training. The first thing you should do in an advocacy meeting is thank the legislator about anything, right? Sometimes it'll be obvious, but find something to thank them on to kick off the meeting because it just sets the right tone, right? That's absolute hot tip for advocacy.
Katie, that's such a good suggestion because not only does it get them to your event or get them on site, they love the photo op. It makes them look incredible and they will definitely get mileage out of that. So it's mutually beneficial. Tesfa, I guess I'll go back to my it's not that complicated comment because I think one of the biggest things that every single person here can do is think about the act of voting. It is the most effective way to directly influence policymaking. We know that. And there's just no tool greater than your vote. So this is where you personally can encourage your colleagues, your friends, your neighbors to vote in November. And that is voting down ballot, not just the headliners. Because we all know how important the state and local level can be as much as the federal policymakers. And then professionally, I think this goes back to the point about how can you share what you do with them? You can share the impact of the programs, and that's definitely really important. But how can they even just know what you're doing on the ground? Because they don't speak public health. They don't know what it means to conduct public health surveillance. They don't know what it means to implement programs or run a campaign. To them, it's just jargon. So, like, how can we actually help them understand what it is that you do? Inviting them on site is an incredible suggestion. It could be a fact sheet or a report, that goes different ways, but really getting in front of them via email, via a 15-minute phone call, a 15-minute in-person meeting, that they'll all be back during the August recess. So they'll be home. You'll have better access to them in your home state than you do in Washington, D.C. at that point. But just get in front of them and let them know what you do and why it's meaningful to the community.
Thank you. Thank you to all three of you for that response. I have a quick follow-up question before we get to the feedback that our audience members shared with us. A quick follow-up question. If you could just succinctly respond to this in 30 seconds or less. Checking your politics at the door sounds good in theory. I am a big believer of it personally. Considering all that has gone on in the field of public health specifically, and if we zoom out outside of the field of public health, we're living in really polarized times where the actions that are being taken to the field of public health feel deeply personal. And so that creates inherently a challenge, a tension there with checking your politics at the door, because politics aren't separated from values in many ways for the average American. How do you practice what you preach?
Yeah, I'll give a couple examples and just acknowledging this is could definitely be easier for me than other folks who are feeling direct personal impacts from some of the decisions that have been made. So I acknowledge that. I'll give a couple examples here. So first, what I mean is finding that common ground where you can is important. And I've had folks who I know if I'm going into their office, they are just theoretically maybe a pro-life lawmaker. So I know I'm not going to get anywhere if I talk to them about recent decisions that have been made on reproductive health. But maybe they care about something like tick-borne illness, for example. And so I'm going to take my chance there and try to build that relationship using that issue. And then maybe down the line, after I've built that relationship and have some trust between me and the lawmaker, I can go back to some of those thornier issues. So part of it is timing, right? Like you don't want to come into an office with a lawmaker and talk about an issue that you know they're not with you on and just immediately get that door slammed in your face and not be able to build that relationship. So part of it is timing, like know when to bring up thornier issues. And then the other thing I said is just I've heard so many times from public health advocates that clearly align more with Democrats. They talk about how we just have to wait for the next Democrat to come into office. But what I've experienced, and Katie, I think, alluded to some of this in the last year, meeting with other congressional delegations as part of the Healthy States Collaborative, Republicans and Democrats, they both care about public health. What is happening is you can't lump Republicans all into the same bucket, just like you can't lump Democrats all into the same bucket. Oftentimes, it is the Trump administration at odds with some of the Republicans in Congress about how best to protect and promote public health. And so trying to understand that nuance when you're talking to, for example, a Republican lawmaker, that they're in a pretty tough situation politically. They've got the administration on their back, but they care about this issue. And so, as an advocate, it's your job to help support them and give them the cover they need to do the right thing. And sometimes that means not attacking them about other decisions that they've made because again you're going to get the door slammed in your face and that doesn't help anybody. At the end of the day, we're about impact and we're about winning and trying to get results for public health. That's what I focus on. A lot of the other things that you mentioned, Tesfa, are absolutely valid and true, and it can be really hard, and I've experienced it myself. But if you have the long game in mind, that's how you got to think, in my opinion.
Thank you, Matt. Sharon, Katie, any succinct responses? Things to add?
Would just quickly add, we want to provide them a solution. So it's not helpful to just go and wring your hands. We were kidding around when we were having the planning call for this conversation, and we made the point like you can't depress your way into policy, right? So we want to go and we want to say this is a solvable problem. We all want the same thing. The end game really is the same for everybody. We want a healthy, thriving community. We might have different ideas about how to get there. So our job is to provide them a solution, make it achievable, and then that's the it. Like we talk about overdose a lot. We want overdose to be something that all of our communities are not suffering from the way that they currently are. Well, we get to go in and say, hey, we know what works. This is a solvable problem. This is what you need to invest in. That's going to achieve X, Y, and Z, and this will be the impact on your community. And you just make it easy for that. And you say, it's sort of the tail wagging the dog. Like, hey, I'm here to help you. I'm here to make you look good.
I think just to build on that, one thing that we have done, we did it in global health, and I think, on domestic health too, is there are members who feel like they cannot stand up to this administration. And so linking those members together to sort of give themselves cover is really helpful. So figuring out, are there six members who care about this issue who, if they have the cover of other members, are willing? Or I think, like Matt said, like you understand the primary calendar and like they might not speak out on this till after their primary, And like, I think being sharp but giving grace is sort of how I like to think about it, right? Like pushing them really hard, but understanding that there are different pressures on them that are on us and trying to find that common ground. And linking those people together, because it does sometimes, not always, but sometimes it does work to say like, oh, there are 6 or 8 members who maybe aren't obvious but do care about tick-borne illness, and they'll do something together, right? So
Well, I have one last question for you before we move into closing the formal part of the session and open Q&A. And the question for you is in response to the polling that our audience members responded to in terms of what's one thing that they're going to do after this discussion. And the common theme that we're seeing overall is considering unlikely partners. And that's a message that each one of you all have shared throughout today's discussion. So taking into consideration that that's a theme that we're seeing, that's a key takeaway, that an action that our colleagues are going to take after today's discussion is looking for ways to engage with unlikely partners. What's the first step that they should take?
I think start talking in your community to folks to see who could potentially be interested. And again, and I look back at some of the, I'm sure I have bazillions over more than 20 years of policy failures, but in almost every one of those cases, we did not bring in other partners till it was too late, right? You got to talk to them early. You got to get them involved early before it is a dire situation. So those conversations now, right? You're at the local gas station. You're talking to, I've got 3 kids, so I spend a lot of time at pickup and drop off talking with the other parents. That is how you can sort of start to build. It's an informal community organizing. A mom's group chat goes a long way, it turns out, in my in my life. And so don't wait until it feels like an emergency to start reaching out to other partners.
I'll say too, be proactive. Like Katie was saying, be proactive in trying to find that common ground issue with the person or the group and fit it into your timeline, right? You might have something that you know you're going to need their help on, but they're a little iffy on whether they support it. And so you got to start now by reaching out on the issue that you know you can agree on and build that relationship. And I think honestly, it's a mindset shift, Tesfa, that like I've had folks who have told me I don't want to talk to that lawmaker because they don't support these XYZ bills that we support. I'm like, well, I get that. I understand that, but they do support these other bills that are also on our priority list. So let's go talk to that lawmaker about those bills. This like you're with us on everything, you're not with us approach that I see sometimes is just, again, it's not good for the long game for us as a field. And so be proactive about really trying to find that common ground issue with the group or the person and start there.
Yeah, and I think the only thing that I can add here is that ironically, sometimes the best partnerships come out of people who, or partners who maybe presented barriers to your work originally. I think about one area where we do a lot of work and we were really experiencing challenges getting law enforcement records, and it was becoming a real issue. And ultimately, law enforcement, the National Sheriff's Association and the International Association of Chiefs of Police came around, after we engaged quite a bit about the work itself, then they came around to being a really incredible partner on the advocacy side too, once they sort of drank the Kool-Aid and understood the value of the work and why it was meaningful for them to engage. So sometimes the people that are standing in your way and your obstacle are actually going to be your best friends eventually.
Well, thank you all. You all brought really practical insights, and I appreciate the honesty that you all brought to this conversation. It's obvious we need to not only make the case, as you point out, with our minds, but we need to motivate and push people to move and take action with their hearts. And with that, I am not ending the conversation, but actually opening it up to our audience for any questions that you all have for our panelists that were not covered today, that we did not get to. We were actively monitoring the chat. And so if you have a new question or a question that you already put in the chat that you want to surface up to make sure that we address it, please do so. And while folks are doing that, I want to highlight a question that came up related to folks who are earlier in their careers, who may be a recent graduate. And the specific question is, how can recent public health graduates find their place and their hope in public health in light of the conversation that we had today?
I mean, we need the next generation more than ever. I think having young and new voices elevates our work incredibly. And don't be discouraged, I guess is the point. It definitely in my career, this is the most discouraging time, but in public health, there's always going to be ups and downs, and there's a lot of opportunity. And I think, um, we need as many people with us as possible.
I'll piggyback off of what Katie said, and I think sometimes we do think things are potentially worse than they actually are. Like we're all here because we've had success in the last year advocating for important public health programs and funding, and we've succeeded. All of our core CDC funding that we highlighted in the last year was fully funded in last year's appropriation cycle. So just to be clear, like we can still make a difference. We can still make an impact, even though it's a hell of a lot harder in some ways than it used to be, advocating for these issues and programs, but we can do it. And so stay optimistic again, like Katie said, but I would say to cast a wide net, like people can bring different strengths to this field. I was an English major. I did not study public health. I came to this from lots of twists and turns. And so if you're out there and you don't think of yourself as a hard, specific like MPH public health person, you could still potentially bring some really valuable skills and strengths to the field. So cast a wide net in how you're thinking about your career. I know folks who thought they were going to end up practicing one part of public health and ended up on a totally other side of it. Just be open and test the waters across the field and see where you might fit.
Yeah, this is actually, I'm going to take my advocacy hat off and put my professional association hat on for a minute. I mean, first, I just want to validate that it can feel really daunting right now, building a career in a field where funding's unpredictable. And I mean, even just trying to gain experience if organizations aren't hiring. So I think, first, nobody is alone in this. We know that this is uncertain, but and people in this field have before and will again build deeply meaningful and impactful careers in these circumstances. So I think the biggest thing that I would pay attention to right now is just how to gain hands-on experience in any way, shape, or form. Um, Part-time roles, fellowships, virtual internships, project-based work. Get to know the organizations doing work that you care about and really build your network because not unlike advocacy, relationships matter. They open doors, there's mentorship, and it can also just keep you grounded when things feel unpredictable. Think about some of those creative partners that we've been talking about. Like maybe you're not working in public health proper, in a health department setting, but it can still really be meaningful public health work, doing community level work, that type of thing. So, and lean into your professional associations. And I promise I'm not doing this as a sales pitch for mine, but really that's also the job of professional associations is to help usher people in and find opportunities when things are looking a little bit hairy.
And I am doing this as a sales pitch for ours. You should absolutely join your state public health associations. They're great places to build your networks, great places to build your skill sets. And I'll say too, like, yeah, reach out to folks for coffee. People love to talk about themselves, me included. And so reach out and say, hey, I'm really interested in what you do. Can we meet for coffee? I'd love to hear more about what you do as a career. And people will almost always say yes.
The last question for you all from the chat and feedback that we're getting from our participants. It's a common question that comes up often. In the field of advocacy, how do you address the challenge of mis and disinformation?
It's interesting to see the way that it has spread, mis and disinformation, and public health have not used those channels, whether it's social media or others, to try to counter it very well, right? I quote this, Laura Gay, who I used to work with at Elizabeth Glaser Pediatric AIDS Foundation. She's an amazing, amazing um, public health professional. And she used to say to me, I would give her things to review and I would say, is this technically correct? And she's like, do you want it to be fully correct or do you want it to be sexy, Katie? And I would say, I want it to be sexy, Laura. You have to think about how we are communicating in a way that is not like 3% of people after blah, 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 And so I think don't be afraid to sort of counter some of that misinformation through those same channels. It's like we're afraid because that's where this stuff brewed and grew that we can't also use it to our advantage. And you do see some really great influencers trying to do that and are starting to break through.
Yeah, I was going to say, I think disinformation working with legislators is a lot different than disinformation working with the public. So I think working with the public, that is a whole different field, and that is above my pay grade to give advice on. I would say in the advocacy space, there's sort of two mindsets. Some people say don't repeat misinformation because then you're sort of just formalizing those channels in the brain and doubling down. There's also sort of that theory about, they call it, I think, pre-bunking, which is almost like it's like an inoculation, like a word vaccine, where you're kind of saying a little bit of the misinformation, but then immediately sort of heading it off to be able to say, like, okay, well, maybe you heard concerns about duplication between CDC and SAMHSA. Well, let me highlight exactly how these are disparate and, very, very specifically different groups on the spectrum. So you can do an element of that. You just don't want to lean too hard into getting into like those very specific rumors, because, and this probably holds true for the public too, that you're likely going to double down and make people reinforce their beliefs at that point. So we don't want to do that.
I absolutely. Oh, sorry. Are you done, Sharon? Yeah. I hate when I see graphics where it says myth, fact, myth, fact, because again, like Sharon said, people remember the myth, right? That's what sticks in their brains. So yeah, I don't repeat. I think I'm glad you separated it out from the audience being policymakers versus the public, Sharon, because I wasn't thinking of it in that way. I think people forget, especially at the state level, like lawmakers are people, right? They're not subject matter experts most of the time, especially at the state level, like in Maine. We have a part-time citizen legislature. They're regular people who just want to make a difference. They care about things. So it is hugely important for public health advocates to be communicating them and giving them valid information on the regular. For me, it gets back to what I said at the very beginning of all this. Like, it's about trusting the source too. And the way to establish trust in yourself, get out there and talk to people in person. Like, I totally agree with what Katie said. We got to use the channels online and the social media stuff. That's not where I'm best, being honest. That's my weak spot. But really, the way to counter a lot of this nonsense is get out there and talk to people in person and make sure that they see you as an ally, that they understand you've got their back, because then the next time you go and give them information about vaccines or whatever it is, they're actually going to listen. You still might have to do a lot of work to get them to buy into it, but they're going to listen to you. So again, I'm like, go back to the old school, get out there and talk to people in person. You got to do it.
Well, Sharon, Katie, Matt, thank you. Thank you for not just joining us today, but sharing your experiences, sharing your insights, and above all, being honest about the opportunities that we have to take action, where we would run into and can run into challenges, and how we overcome those challenges. We hope that you all took away some really helpful insights from today's discussion with Sharon, Katie, and Matt. I just want to highlight, as I mentioned, this is the first of a 3-part series where we want to provide practical insights and tools for you all. And we recognize that learning comes not just from listening into and participating in this discussion, but being guided through and being provided with practical tools and guidance. And with that, what we have are 2 other sessions that will be coming up. One in August, that's session 2 related to power mapping. And the title specifically is Power Mapping: Actions to Take Before and After the Midterms, recognizing that this is a moment in time where we need to take action as a field, where you'll learn how to build a power map, focusing on preparing for the midterm elections and strategically engaging in advocacy activities for change. And that is coming up on August 13th, later this summer. And then lastly, the third session is touching on what we've discussed throughout this discussion, how to make the case, how to persuade decision makers. And session 3 specifically is from need to value, how to persuade decision makers. As Matt, Katie, and Sharon pointed out, they are people too, and there are specific skills for engaging with decision makers to not just convince them. It's not convincing them at one point in time transactionally to take up a public health issue, but it's building a relationship with them over time, playing the long game, as our panelists pointed out. So we hope you all will join us for both of those sessions. Again, thank you for joining us today. Thank you to our panelists, and we look forward to engaging with you all soon. Enjoy the rest of your afternoon.